Good morning, everyone. Kevin Wood here on Coffee Talk again, another bright and cheerful morning. And I have to say, I'm feeling really good about the person sitting across from me because he may one day save one of our lives. Dr. Louis Gruberg of Northwell Health, Mather Hospital. Welcome.
Thank you for having me here.
Absolutely welcome. I feel your importance in the world cannot be overstated. I read once that let's just get right to the point, we just are going through, hopefully getting over COVID, but many, many sad stories. But I'm hearing somewhere 600, 700,000 people a year die of heart disease in the United States.
Yes, that is true. And it's an impressive number, unfortunately, of people that will die by cardiovascular diseases, which is the number one killer for the United States, yes.
I think people sometimes forget that. And I think that what you do, well, why don't you tell us? There's some big news. It's been floating around Port Jefferson in various news outlets. I know you were good enough to come in and visit us at the Chamber of Commerce the other day. What was the news exactly? Let's tell our audience.
As we are discussing, cardiovascular disease is the number one killer for the United States. So one of the things that cause this mortality is having a heart attack, of course. And when you have a heart attack, what you have is a blockage in one of the arteries that provide blood supply to the muscle of the heart itself. So that gets blocked, that causes the heart attack. Through the years, we've learned that opening this blockage as fast as we can saves the muscle of the heart and therefore the person. So we try to go as fast as we can into a cath lab, and under X-ray vision with appropriate equipment, catheters and all balloons and stents, we're able to open the blockage in the artery and restore blood flow to the heart muscle and therefore prevent damage to the muscle of the heart.
So with that, the big news I understand with Mather Hospital, Northwell Health, was that New York State designated a mile from us, not even, up the hill, literally, this new facility that you are directing, of course. So there's a physical new facility, correct?
Well, it's not. It's part of the Mather Hospital, but we are building a brand new cath lab. Mather, for many years, has been seeing patients that have heart attacks and unfortunately had to transfer those patients to other institutions, such as Stony Brook or South Shore Hospital, to provide the appropriate care for these patients. Now the Department of Health for the New York State has approved the construction of the new cath lab, and it's already there. So hopefully we'll get a opening ceremony next week, and obviously we hope that the cath lab will be functional on May the 18th. And it's a brand new facility. We have 2 state-of-the-art brand new cath labs, holding area for the patients. Everything is absolutely beautiful.
Give me an idea of what you'll actually manage. You'll manage doctors within the cath lab, technicians?
Yes, the whole thing. So a cath lab, it's a big operation. You need equipment, state-of-the-art equipment, X-rays. We do all that under fluoroscopic guidance. We have nurses, we have radiation technicians, we have CV techs. We have a support staff that is going to take care of these patients once they are, before the cath lab, after the cath lab. So it's a big team that is good doing this.
So I want to ask you, I remember in the 70s, my grandfather's heart was perfect till 95. My grandmother, because hereditary aspects come into this, as you know, I remember it like it was yesterday. In my house, I was a kid, she had a heart attack. Ended up in South Shore Hospital, which must have been known and probably still is known for some heart work, because I remember she was particularly brought to South Shore Hospital at that point. Is there something different? And they found out she had hardening of the arteries, and it eventually did kill her. Is there hope? I mean, you're talking about something that helps people after the fact. Are there things now that are helping before the fact?
Well, like I said before, a heart attack is actually the most dramatic portion of what we do on every day. But we have to remember that there's also people that have narrowing of the arteries or hardening of the arteries without having a heart attack, and they have what we call angina pectoris, the classic, the chest pain, the pressure, the difficulty breathing when doing any type of stress. In those cases, we can go and open the blockages if there are any blockages, or just to do a diagnosis, to see if there's blockages in the arteries of the heart. How is the heart functioning? Valve issues, if there's somebody has narrowing of the valves or valves that are incompetent. So we can go out and assess all these patients. So we will be able to do that at the Cath Lab.
So a good example is at my age, in my 50s, I'll say that, right? So for the first time, you're right, they'd be able to see things beforehand. And I know that certain things I've been, put on some Lipitor, for example, and some things that I think are positive, seeing things before they happen. Thankfully, I'm good, and I don't have any real problems. But it seems to me that these machines are really, really good at seeing things before they can happen, right?
Absolutely. Like you said, medical treatment has changed significantly over the years, and nowadays we have amazing medications that can really help prevent and also treat patients that already have heart disease. But definitely there's a point at which we need to intervene, and this is where, we will have that technology available at Mather to go and intervene and do a clear diagnosis if there's any blockages in the arteries of the heart or any other things that may be dangerous in the future. Absolutely.
Talk for a second about your early years. I notice your dialect. Where are you from, and what was that like growing up, and how did you get to the United States? You're Bolivia, right?
I'm from Bolivia, yes.
A very biodiverse country, right?
Yes. My parents escaped Europe during the war. My mother before the war, my father after the war. They met there, and Bolivia was one of the few countries that accepted Jews that were escaping the Holocaust. And I was lucky enough to be born in Bolivia. I grew up there. I studied medicine in Bolivia. Then I emigrated to Israel. I worked in Israel for a number of years. And then I was doing a lot of research in those times, and I was back and forth with the United States in Washington, D.C. I spent 5 years in Washington, D.C. doing research at the NIH.
Excellent.
And then Stony Brook asked me to come to Long Island, and I came to Long Island.
Is Long Island truly now becoming a world, or at least a national centerpiece for health? I mean, you have NYU Langone, you have Stony Brook, you have Northwell Health. It seems like this is a great career choice for someone.
Yeah, Long Island is very well known for its medical field. It has a lot of opportunity, high-class research, very good hospitals, like you said, and the close proximity to New York City, where you have the big guns, like the Columbia, you have the Mount Sinai, Lenox Hill. Yeah, definitely, we are all part of a very rich and talented community of doctors.
So tell us about this grand opening, and what could the public actually participate in this?
So we are having the actual ribbon cutting next week, like I said before, and I just came from Mather and look at the labs, and they are absolutely fabulous, And I think that's going to be great for the people of Port Jefferson and for the whole community in this area to have the availability to go to this hospital and get this type of care.
Fantastic. Let's get some good advice for our listeners out there. What is good heart health care?
We need to remember that the first thing is prevention. And, prevention starts at the very base, and it's the basic things, exercise, a good diet, no smoking, absolutely no smoking, and taking medications, taking good control of the blood pressure, taking control of the lipids, cholesterol if they are high, starting with a statin if needed, diabetes, high blood pressure, those things have to be very well controlled.
The blood pressure is very important, right? There's many people, particularly I think men and women, and I didn't realize how many women have heart attacks. I didn't realize that.
Yes.
That this blood pressure, you just let it go, months go by, years go by, and it's giving stress to the heart, correct?
Oh my goodness, yes. That's why we call it the silent killer, right? We don't feel it. Sometimes some people may feel a little headache, or that's about it, but definitely hypertension is a big concern, and if you have a combination of things such as high blood pressure and diabetes, then definitely you should have that blood pressure very well controlled. And like you said, women have about the same number of heart attacks as men do. And although it's a little different in the type of signs and symptoms that they get, still number one killer out there.
Well, I tell you, we're very proud to have you here on Coffee Talk. I think you have, I read some reviews. You're really well revered and much appreciated that you came on. We're going to do our best to get this knowledge out. This wonderful news, one of, I think, the only one in Suffolk County just recently by New York State was authorized, correct?
Yeah, this is a new authorization to open a cath lab. Actually, Peconic Bay opened a cath lab a couple of years ago, and I was part of that too. Very successful program, very talented people working there too, yes.
Good. Well, God forbid anybody needs your services, but if, God forbid, they do, we feel good about you being there. We appreciate it. Congratulations on your new position.
Thank you so much.
And we'll hope to see you at the grand opening.
Thank you so much. I hope to see you there.